Now, a new report has found that some hospitals have gone unchecked for up to 10 years.
Yes, the state of the Care Quality Commission apparently stunned the new Health Secretary, Wes Streeting. Well, he joins us now. Very good morning to you, Mr Streeting. So tell us a bit more about this. This is all about the NHS watchdog, isn't it? And ministers now saying it's not fit for purpose.
Yes, that's right. In my first week as the Health and Social Care Secretary, I was confronted with the initial findings of this review into the Care Quality Commission by Dr Penny Dash, a highly experienced and respected NHS leader with decades of experience. And I was stunned. I mean, I knew that the NHS was broken, and I said that on day one, but what I didn't anticipate was receiving a report that revealed that 1 in 5 health and care providers has never been inspected, that there are cases of hospitals not being inspected for over a decade, a care provider that hadn't been inspected since 2015, and even the ratings that are published and that we use as the public to make choices about where to receive health or care, some of those are frankly bogus because of the way in which they've been put together based on either partial inspections or piecing together more recent inspections with historic verdicts on those health and care providers. Any one of those facts taken individually would be shocking. Taken together, it is an indictment of a regulator that is supposed to be there to safeguard standards and patient safety and provide us with a true and fair and accurate reflection of the quality of care provided. And that's why I don't have confidence in the Care Quality Commission and why radical reform of the CQC is required.
Well, what does radical reform mean?
Well, first and foremost, leadership. One of the reasons why I've chosen to publish the initial findings, the interim report, urgently ahead of the full report is because as we recruit a permanent chief executive and chief inspector of hospitals, I want to make sure that we get the very best candidates. That means both being honest with them about the scale of the challenge, but also reassuring brilliant candidates out there that they will have the full support of the CQC board, but also the full support of the government to turn the organisation around. And secondly, there are ratings that are published today that I don't think we can have confidence in, and so I've asked the CQC urgently to be more transparent about how those ratings were put together so the public can make more informed choices. And thirdly, this is about urgency and it's also about honesty. I think the reason why we are in this place is for too long we've had a political leadership in this country that wanted to brush these problems under the carpet, that wasn't prepared to hear uncomfortable truths because then they would have to account for their appalling failure, their mismanagement of health and social care over more than a decade. This government will be different. I said we'd be honest about the scale of the challenge. That is what we're doing, and I hope in that honesty people take reassurance that by writing an accurate diagnosis we can write the correct prescription.
I mean, it's an interesting thing because I know, as a new government, you're still a little bit in opposition mode and sort of blaming the Conservatives, and that's all well and good, but it's almost a bit pointless now because it's not about what's happened before, is it? It's about what you do moving forward, and you've had plenty of time in opposition to come up with things, and you were meant to be when you got into office, looking at more radical solutions. I know it takes time, but when are we going to get some sort of strategy as to how you're going to get the NHS back on its feet?
Well, today marks 3 weeks since I was appointed as Health and Social Care Secretary, and in those 3 weeks I have hit the ground running, getting ready the 40,000 more appointments every week that will help us to cut waiting lists, and not just more appointments but different ways of working in the NHS so we get more bang for the buck, more productivity out of the system. NHS England reported to their board yesterday that we're now finalising the operational plan for the 40,000 more appointments. I said I would call the junior doctors on day one, and I did. I got them into the department in week 1, and negotiations are now underway, well underway, to end these strikes fix and make sure that we can get the NHS back on its feet. I did the same with the dentists. I said I'd meet them on the Monday after the general election. I have, not just to get their help to stand up the 700,000 more urgent dentistry appointments, but also to start that process of contract reform. We've announced the Mental Health Reform Act in the first King's speech. We're hitting the ground running on public health measures, not just the smoking bill, but there'll be more to come on public health. We've done all of that in the first 3 weeks. You're right, it is going to take time to turn around the NHS. It is broken, but it is not beaten. And one of the things that gives me both hope and confidence about the future of our NHS and social care system is there are brilliant people who are willing to roll their sleeves up and put their shoulder to the wheel to work with a new government to turn the situation around. And I'm confident that when we get to the next general election, people will be able to judge us on a simple question: are things better in the NHS now than they were when Labour took office? We've got the right team, we've got the right plan, and we've hit the ground running in the first 3 weeks.
Can I ask you about the situation on public finances? Rachel Reeves expected to reveal a £19 billion black hole. How is that black hole going to be plugged? What sort of tax increases could we potentially see in the autumn budget?
Well, firstly, I'm not going to preempt what the Chancellor will say on Monday, but the situation is dire, and not just in terms of the general state of the public finances and the economic outlook, which we obviously all knew about before the general election, is one of the reasons why Labour was so disciplined about our manifesto, because we wanted to make sure the promises we made were promises we could keep and the country could afford. What has been truly shocking is the in-year position that we have inherited, and we are going to have to take tough decisions to balance the books. And what I will say ahead of the Chancellor's statement on Monday, she has some really tough choices to make, but the whole government has tough choices to make with her. We support her 100% in the work that she is doing, the heavy lifting she is doing to clean up the Tory mess they left behind, which we are all paying a heavy price for in terms of the state of our public services, the state of the public finances, and frankly the state of family finances.
I mean, the problem you've got, though, Minister, is that, you know, that £19 billion black hole, as you say, everyone's behind the Chancellor, but that could affect what you want to do with the NHS.
It was going to have an impact right across government, no doubt about that. We knew that there would be tough choices. It is even worse than we feared, and I think the Chancellor will spell that out in terms on Monday, but we are not ducking these difficult decisions. We're not pretending that things are better than they are. What we are prepared to do is make the tough choices now that mean our country is on a path to a brighter future as we work to rebuild our economy, rebuild our public services, but also rebuild trust in politics and politicians. And the same discipline you saw, iron discipline you saw from Rachel Reeves as Shadow Chancellor, you will now see from Rachel Reeves as the Chancellor, backed fully by her colleagues in the Cabinet and the entire government. We will do whatever it takes to get the books balanced, to get the public finances back in good shape, and to make sure we get our economy growing again so that the choices facing our Labour government in future years, and most importantly, the material conditions of families across the country improve for the better. We will only do that if we get to growth. There are some tough choices to be made in the meantime, and we will make those tough choices.
There's been unrest in Rochdale for the second night in a row now over this video of an incident at Manchester Airport where a police officer allegedly stamping on a man's head. That police officer has been suspended. Now, Andy Burnham, the Mayor of Greater Manchester, has called for people not to get involved in protests for political purposes. What do you have to say about that incident?
I'd say two things. Firstly, that video was truly shocking. It's right, the officer has been suspended, and I'm glad that both Andy Burnham as the Police and Crime Commissioner, Yvette Cooper, our Home Secretary, and the police, particularly through the referral to the IOPC, are taking this as seriously as it warrants. There is absolutely no justification for people using this incident to protest in a way that we have seen overnight with some pretty shocking scenes outside police stations. That's not the right way to go about this. That incident is being taken seriously by the authorities, and people should take reassurance in that. I understand, having seen that footage, why people are angry, but what must not be tolerated are people lobbing things at police stations and using this incident to sow what is, I think, unacceptable levels of disorder, and that won't be tolerated.
Minister, good to talk to you this morning. We appreciate it. Thanks very much indeed.